Hello, salam, namaste. I'm Dr. Veena Barsiwal, and this is Chai, Chat, and Community. I would like to begin by acknowledging the traditional owners of the land and pay our respects to elders past, present, and emerging. Friends, it is time to have chai together while addressing another important topic impacting us and our community directly or indirectly: teenage pregnancy. It refers to pregnancy between the ages of 13 and 19 years, the time when the body is still developing and growing. Apparently, not an ideal time to get pregnant. Hence, it has its own unique medical, emotional, and social challenges. Dr. Preeti Khillan will tell us all about it today. Welcome to the show, Dr. Preeti, and thank you so much, as always, for being here with us.
Thank you, Veena. Thanks a lot.
So I'll start the series of questions. Yeah, thank you. So let us begin with the prevalent myths. In your practice, you must have seen, different misconceptions or myths that people come with and they come and ask you and they are so convinced about it. So please share some myths with us and how that you hear from the teenagers or their families in multicultural communities.
Um, Myths about anything particular, Veena? Contraception, you were talking about?
Could be about contraception, could be about being a teenager and getting into sexual activity as such.
Hmm.
So if we do it, or what is the right age, or should they be doing or not doing? So anything that you come across,
Look,
which
I
you
mean,
hear commonly.
yeah, starting with, you know, uh, myths about contraceptive use,
Right,
that
right.
is one of the things which is very commonly, asked me. People, young people, fear that if they take any contraception, it can cause the infertility in the future or delay their fertility. Look, this is not
Mm,
true, right?
mm,
Because most of the contraceptive options which we have cause, once they're stopped, the rapid return of fertility happens, but except for some of them like the injectables, which can delay fertility for a slightly longer period of time. That is one of the common myths. Then the other thing is people think that, look, I will gain a lot of weight. So weight
mm,
gain can happen with contraception, but
right.
it is because of other some reasons, as first of all, there can be fluid retention in the body which stabilizes after 2 to 3 months. There
Okay.
can be change in the appetite as well, which can cause a little bit of weight gain. And then lastly, it could be hormonal influences as well. And usually around the perimenopausal age, women tend to have a little bit of weight gain, that is
Mm,
hormonally mediated. So when you go on any contraception, you could have a little bit of changes and fluctuations in your weight. But if somebody comes and tells me that I've gained 10 kilos in the last 3 months, then that is an alarming sign. Something else is happening.
mm, mm,
Then the other thing, which what is commonly a myth, is that people think that, look, if I take an emergency contraceptive pill, right, that is an abortifacient, I'm aborting the fetus. That is not true. Emergency contraceptive pills are made and to be taken to prevent or delay ovulation so that pregnancy does not happen if
right.
there is unprotected sex has happened. Then the other thing is about the contraceptive devices, the intrauterine devices. There is a myth that people who have never had children can never have the contraceptive devices inserted, but that's not true. There are
Mm,
good contraceptive options and they can still be inserted in people who've never been pregnant.
mm,
And these are the common myths we see. And also, one of the things is that if people come and are talking about contraception, they feel that they are being judged because does it mean that they are getting a license to be sexually active? I think this is not what it should be. This
mm.
is absolutely not true. So, these are the common myths about contraception.
And that definitely should not stop them from coming in
Yes,
and just
absolutely.
taking advice that, okay, what is the right thing for me and my body? So,
Absolutely. Absolutely. Yeah.
so some really good ones and common ones that you have shared. So it'll be very helpful. Thank you for that. And so different multicultural backgrounds you might see, or I should say that different cultural backgrounds, you must have seen changes in differences in the rate of pregnancy, teenage pregnancy in particular, because that's what we are talking about today. So, from your perspective, what are the main cultural and systemic barriers that prevent young people from accessing reproductive health information?
Yeah. So look, being coming from an Indian background myself and working in amongst multicultural women, the
Right.
commonest thing is that from the start of menstruation, talking about menstruation, sexual health, pregnancy is considered a taboo, in many communities. If I recall back, like when I was young, when my mother used to tell me that, look, once she started having her periods, menstruation, she was not allowed to go into the kitchen and cook for 5 days. So
Mm,
these are sort of, cultural taboos which are main restrictive factors. The other thing is language barrier, because not everyone is able to express. And
mm,
unless they find that right, connection with the healthcare provider, so use of female doctors, especially, of your own culture, female interpreters, these are the things that will really help because these can be barriers, to get, to seek, prevent people to seek advice. Then
yes.
the fear of being judged, the fear of
Mm,
being judged by
again,
the family
a big
itself,
one.
that if they are talking and they're asking advice about contraception, about sexual health practices, safe sexual health practices, they're going to be judged that what would people think, what would my parents think? And look, this is one thing which we really have to educate young people that that's not how it should be, right? This should be an open discussion. Actually, it is so good if it starts from the family. But look, there is a lot of hesitation still in many, family in
Mm,
many cultural backgrounds to discuss these things openly in the family, and that's when the young people should be comfortable to seek, professional advice. And also the lastly, is the wrong influence of social media. I think, that is one thing which really impacts the youth of today. So once we start removing these barriers, I think it will be very easy for young people to seek advice. And also, they have to remember they are sometimes worried that if I have gone for a consultation, it will be in my records, it will be documented. If
mm,
I've taken a prescription, it will be in my Medicare records, and oh, that will be known to everyone. But these things are really confidential. So
mm.
confidentiality is maintained, so that's what I want to assure young people that look, if you come and seek for advice, it is documented, it will be in your records, but that is never shared unless, only in very rare circumstances, which I can talk about later.
Yeah, some conditions are there,
Yes, yeah,
which,
yeah,
again, for their safety only, those conditions are in place.
yeah.
So, one of our viewers has asked that how prevalent is sexual activity among teenagers? What would you say?
Look, I don't think we can give a very
A number.
percentage,
Mm,
but with teenage pregnancies, we have seen that it has really dropped down in Australia over the last 10 years. So I
okay.
think the incidence of teenage pregnancy is around 7.1 per thousand live births, but it has
Mm,
really considerably dropped down. In Australia is, I think, one of the countries where the teenage pregnancy is the lowest among
lowest.
other developed countries. Yeah,
That's
yeah,
good to hear.
yeah.
So, for a teenager who might be listening in, although you have shared a few things, in secret or like she's too nervous to ask, what are the safest and most effective options for contraception available today?
Okay.
And how do they
So
work? Like,
yeah. So look, there are number of types of contraception. Uh, each contraceptive choice is tailored according to the needs of the person, right?
right.
It depends on the age. It depends on whether you have a stable partner or not. It
Mm,
also depends on how compliant you are. If we prescribe you the oral contraceptive pill, whether you're compliant, you're mature enough to remember to take the pill every day, right?
mm,
And also, it also depends on what you're seeking. How long-term option you're seeking, whether it is just at the moment, to delay fertility for a few years or not. So
right.
if we start with the contraceptive choices, we start with the oral contraceptive pills, right? And there are two types of, contraceptive pills. One is with
Right.
the combined hormonal pill, and the other is the only single progestogen hormonal pill. And
Right.
they all mostly work by delaying ovulation. They are good choices for young people if they have, very painful periods or heavy periods as well.
Mm,
But
mm,
with the oral pill, obviously, compliance is important. They have to remember to take it every day.
mm,
That's one of the things. Then there are other options as the implant. You might have heard about that, which is called the implanon. That's a rod which goes under the skin of your arm.
right.
And that is a good contraceptive option as well because it is something which can be put in the arm and you do not have to remember. I mean, there's nothing like compliance needed.
Mm, mm,
Then we have the intrauterine devices, and
mm,
there are hormonal and non-hormonal intrauterine devices. The
mm,
hormonal ones are commonly, they are called Mirena and Khillan, and the non-hormonal is the copper IUD, which has been prevalent for many years, but actually it is being less used now. Now, I
mm,
have to tell you that there's a new home intrauterine device which is called Khillan, and that is specifically been, for young people who have never had pregnancy or childbirth, which has got a smaller stem and easier to put it in. So
okay,
this is one of the hormonal, intrauterine devices. Then we have things like injectables, which can
right.
be given as well. Not very ideal because these are the ones which take longer to wean off from the system. And then
Mm,
we have a ring as well, which is called a Nuva ring, which could be a contraceptive option. So it actually depends on, the age, the menstrual history, the whether they have heavy periods, whether they have painful periods, how compliant will they be to medication. This is what, this is how we advise them.
so that's quite nice. You have very nicely just elaborated on the different devices and different types available, and also that the person can always in one way choose with, of course, informed this thing that okay, what will work for them. And
Hmm.
also I would say, and you correct me if I'm wrong, that they can, if something is not working, they can try something else
Yes,
and
yes,
which might work better. And for some, like you shared with the pills, if they are having heavy periods, then it takes care of that as well.
yes, yes,
So they can have added benefit as well.
yes, absolutely.
So something which is individual based. So you go to the doctor, talk to the doctor, and according to your body, according to your system and everything,
Yeah,
the mean the whatever you need to use will be chosen.
yeah.
Yeah, thank you. So a major worry among many girls is privacy, right?
Hmm.
So what does confidentiality look like for teenager seeking contraceptives? And at what age they can, because you already told us that it is quite confidential, but at what age they can access these services without needing parental consent?
Yeah. So confidentiality means that, look, whatever information is shared by the young adult to the health professional is not disclosed to anyone, whether it is their parents or their carers or anyone else. There are
Mm-hmm.
only certain exceptions when this has to be, the confidentiality is breached, if it is an order by the court, by
Cool.
law,
Yeah.
right? Secondly, if the healthcare professional thinks that the young person's life is at risk or somebody else is at risk who's connected with them. And lastly, if they feel, the health professional feels that this individual is being abused or there's coercive control,
Right.
right? These are the times when confidentiality can be breached.
Right. So again,
These are the
some.
only. Otherwise, every health this thing information. Now we go by a thing called Gillick competence, right?
Mhm.
This is a legal principle which is used in Australia and in other countries as well. And the main aim of this is to determine whether a young person who has sufficient maturity to make their own healthcare decisions. And this, going just back to the brief history, this came from a famous court case in the UK where a
Okay.
young teenager came to get contraceptive advice
Mm-hmm.
and her mother was not aware and she was prescribed contraception because she was mature enough. And then the mother filed a case against the doctor, but she lost the case. So
Mm.
from then we practice the Gillick competence, and there is actually no age. But if the individual is mature enough to understand the risks and benefits of the proposed treatment, if they
Mm.
understand the consequences of not having and having accepted the treatment, and they make a vocal voluntary decision, and they
Mm.
seem mature enough, they can be prescribed contraception at any age without parental consent if it is for
Okay.
their own benefit. So this is
Okay.
something very important. And
Yes.
that's why when, we have young teenagers come in with their parents, obviously, with all the with our sort of cultural background, usually, the mom would be accompanying the daughter. So in any consultation, it is very important for the health professional to ask if and ask the parents to leave if they feel that the young adult wants to talk to them individually without parents.
So the doctor is going to moderate that, and because they can make
Yes.
out that what's happening, and
Yeah.
then yes, definitely. You use the term coercive control. So one of our viewers has asked that what is coercive control, if you
Look,
can
I
please.
mean, it is when you feel that the young adult, the young individual is being controlled. I mean, she could be in any sort of relationship, but if she's being controlled or forced into things,
Mm,
that is one thing which has to be determined, and that happens, when you take a detailed history. And it also happens after building trust with the individual. Nobody in the first meeting will expose to you, but if you see them number of times, then you know that whether they are being controlled by anyone, and
mm.
they are being forced into certain activities which should not be allowed, or which is not which should
Right.
not be there.
So they might be the
And unfortunately, it could be any family member as well. We know that these sort of things can happen. So
mm,
it is just that, look, anything which is against the wish, or if anyone is being pressurized from doing something, this is what is coercive control, and that has to be determined.
yes, and they might be threatened to do
Yes.
something,
Yeah.
and that in particular would be like somebody's using coercive control. Thank you for that. Um, we know that in many cultures, even talking about sex or birth control is like it's a taboo.
Mm.
And modesty is highly valued, although this is a very important conversation to have.
Mm.
And how can young women navigate these cultural expectations while still taking care of their sexual health?
Yeah, look, I mean, the thing is, this is very difficult. It is a very difficult balance, all right, because we have to be culturally sensitive as well, but we have to educate them, right?
Mm,
Because they're living in a modern world, right? There are influences from everywhere, all right? Peer influences, peer influences from social media,
mm,
and it is very easy for the young mind to be influenced, as we all know. We have children, we know that.
mm,
So I think the first thing is that if it can begin from the family, it is such an important thing that if you can, talk about these things in the family, which often doesn't happen in some cultures, in most of the cultures, that you cannot have an open discussion in the family. I think that is the first place
mm,
that, where, that freedom of expression, freedom of knowing things, freedom of expressing things should be there. Second thing is their own healthcare providers, for finding a female GP, right?
mm,
A female GP, sometimes, if you find a GP, a general practitioner of your own culture, that is good. It can be a bit tricky as well, because if it's a small social circle,
mm,
you may know the GP, your parents may know the GP, and then
yeah.
that might be a point of fear for the young individual.
Mm,
So that is a balance which we have to maintain. Then finding female interpreters is also one of the things, so that, if you're not able to find a GP who can speak your language, or primary healthcare provider, then finding someone who can easily interpret for you. Then some things which have really changed after COVID is telehealth as well. If the individual feels shy that, if I go to the clinic, I'll be seen by people, telehealth also is one of the things which
mm.
can be offered to
Okay,
young
yeah,
people,
right.
right?
Mm,
So that is also the thing. And also, when when we are doing consultations, as I said, that is very important for the health professional to ask the parents to leave the room, to
right.
talk to the young adult alone. If we see that the young adult really wants that, there is a way that we can ask the parents to leave the room so that they can express whatever they want. And
Mm,
lastly is, of course, opening, this sometimes doesn't come in one consultation. It is just a process, multiple consultations, opening layer by layer, as we say, and then trying to dive in the history. This
mm.
is how I think they can just do that, and we have to do it in a very culturally sensitive way as well.
That's really good to hear, and I'm sure it will be good for the teenagers to hear that, and even for the parents to know that you're being so careful and protective, and that is really nice that they are in good hands. as
Yeah,
such. So they go to the GP and get the right knowledge so that you can do the right thing by your
right
baby.
things. Yeah.
That is the most important thing. So our viewer has thanked you, Preeti, for about the coercive control. So because you answered that question and that's information they needed. And you just spoke about being non-judgmental and when the teenager comes and you talk to them. So now the viewer has asked that if you know the GP, because you just mentioned that, what guarantee is there that they don't inform the teenager's parents?
No, so as I said, confidentiality has to be maintained. That is a very important part. That's the oath we
Mm.
take, that you cannot disclose any information.
So you are bound by that. The
You're bound
GP
by
is.
that. And if the young individual comes and tells that they do not want anything disclosed to their parents, that has to be maintained. And there are only certain, as I said, there are only certain times, in those three circumstances where confidentiality can be breached, as I said, by order from the court, or
Hmm.
if you think that that is like individual's life is at risk, or someone else involved with them is at risk,
Right.
or if you feel that they are being abused or some sort of an coercive
Yeah,
kind
you
of
shared with
yeah,
us.
yeah.
Thank you.
So
And are there, because you mentioned language barrier a couple of times, so some resources or support systems in place to for the parents or teenagers who
look,
don't speak English
yeah, so as
till
I
that
said,
time?
finding your primary healthcare provider of who speaks your own language, and I think that's quite easy, because we have many primary healthcare providers, who speak, who different languages.
Mm-hmm.
Then Sexual Health Victoria is one of the places as well, which is good, to approach, and they give good counseling. And
Mm-hmm.
I'm sure they use interpreters there as well of the language.
Mm.
Then there are other, like Kids Helpline, and there is Brave Foundation, but that is usually, for teenage pregnancies, there's a support group. And there is also the Youth Support and Advisory Services that is usually for drug, alcohol services, but also can give advice on sexual health. So these are various, helps which you can, but I think the first thing would be to find a primary health provider who can speak the same language, or to get an interpreter, a female interpreter of the same language.
And
Yeah.
then they'll connect you in the right
Yes.
places and
Yeah.
everything. Thank you. So parents often worry about talking about contraceptives with their children. We know that with the teenagers. So, because they think that it'll encourage them. And so, what does the data actually show about the relationship between comprehensive sex education and teen pregnancy rate?
I don't think there's any fixed data, but as I said that, because of this comprehensive sex education, which has been, and it starts from primary school now, I think, from grade
Hmm.
six, they get this sex
Yeah,
education. Australia has really half the number of teenage pregnancies. As I said, now the current incidence is around 7.1 per thousand live births, and it is really less than all the other developed
the
countries. So
countries.
we are doing well, right?
Mm-hmm.
But
Mm-hmm.
my message is for all the parents and everyone listening is, look, I think we really have to be open in the families. If we are open in the family and we discuss with our daughter, son, about how it is important, for safe sexual health practices, about contraception. I think if there is openness, then it gives, the young adults more, it drives them in the right
Please.
direction. Yeah,
Mm-hmm.
and then they are more educated. They would do
Right.
things rightly, but it doesn't mean that if you discuss this, it's giving them a license to be sexually active. But
Mm.
rather, they'll be more educated, more careful, and they will know that, look, what is the right age,
Mm.
to be sexually active? I don't think anybody can give you an answer what is the right age. But then,
Mm.
of course, that mental maturity has to be there, physical maturity has to be there.
So the knowledge will make them more responsible
Yes, they'll
rather
make them
than,
more
that's
responsible
right.
adults, and then it will prevent them from getting negatively influenced by,
Right.
social media, which is, one of the things I think we all are battling against these days.
That's true. So, how do parents handle, one viewer has asked, how do parents handle when they get to know that their child is pregnant? Have you come across anyone or
Look,
any?
I've had I've dealt with a few teenage girls, teenage
Mm,
pregnancies, working at Western Health.
mm,
And I think usually parents are very supportive,
okay.
and they have to be supportive,
Mm,
right? Because
good to hear that. Yeah.
yes, look, the thing is that that is a young mind, young body. needs a lot of support,
Still
especially if,
growing, still
yes, yeah,
developing.
yeah. And look, here I would really talk about emergency contraception as well, which is one of the things that should be known to everyone. Because
Mm,
if there is unprotected sex, for whatever reason, then emergency contraception is available. It is a
mm,
pill. It's called a morning after pill, which is available over the counter. The pharmacist can give it to you. Ideally should be taken within 3 days of unprotected sex, and that prevents or delays ovulation.
right.
So that is one of the things that everyone should know. If the unprotected sex has happened after ovulation, then it becomes a little bit tricky. Then there is intrauterine device, which is the copper intrauterine device, but then of course that needs referral to be seen to see a gynecologist and to talk more about them, because that prevents implantation if pregnancy has happened.
Right. So the last question is for a teenager listening right now and wants to take the first step towards protecting their health. But they are terrified of being judged by the community, by the doctor. So what advice would you give them?
So I'll tell every teenager listening that look, just be bold, be expressive, be
Mm,
safe, all right? And this is all a natural part of growing up, going
mm,
through these years of life. There are there are safe sexual practice choices. There is contraception available, but look, be very open, be open-minded, discuss any doubts you have. Go and see your GP or a gynecologist. Do not be scared. If anything has happened as well, there's always a way. We just want to educate them to be responsible, grow into responsible adults. And this is a young mind, very impressionable mind. So, all the right influences will make them responsible adults for the future. So there's nothing to be ashamed of. These are things which should really be talked about, and we should educate you. They all need to be educated on this.
And like you said earlier, that it is better to be educated because it
Than be
makes you more
ignorant. Yeah,
responsible and it
yeah.
makes you safer. And safety
Safer.
is the
Yeah.
primary thing which has to be really, that is the most important thing. Okay, as always, Preeti, thank you so much for being here, for answering all these questions, which would be really helpful for anybody listening in. Could it be the parents or the teenagers, of course? So thank you so much for being with us.
Thanks. Thanks. Thank you.